When osteopaths begin working with infants, it's common to think in terms of scaling down adult treatment, using less force or shorter sessions. However, infants are not simply smaller adults. Their bodies are developing systems, and this difference has important clinical implications. One key distinction is tissue maturity. In infants, many bones remain largely cartilaginous. Joint surfaces are still forming with active growth plates, and ligaments allow a great deal of movement. Because of this, joint resistance and tissue texture feel very different from what we expect in adults. What seems like restriction may actually be normal developmental flexibility or an adaptive pattern rather than true dysfunction. The nervous system is also immature and highly responsive. Infants rely on reflexive movement and external regulation. The responses to touch, positioning, and environmental input can change quickly. This means that reactions during assessment or treatment may fluctuate, and we must be attentive to subtle cues of comfort or stress. Another important consideration is adaptability. Infant tissues adapt rapidly to both strain and support. Intrauterine positioning, birth forces, and early handling all influence movement patterns. Some adaptations resolve naturally, while others may contribute to discomfort or reduced mobility if they persist. This is why observation is essential. How an infant moves, rests, feeds, and tolerates handling often tells us more than palpation alone. Applying adult expectations of symmetry, tone, or range of motion can lead to overinterpretation or unnecessary intervention. Recognizing that infants are not small adults guides us how we assess joints and muscle tissue, interpret resistance and tone, choose appropriate force and techniques, decide when to treat, observe, or refer. Throughout this course, you'll be encouraged to slow your hands and refine your clinical reasoning. A careful, respectful approach protects vulnerable tissues while still allowing meaningful osteopathic support.